This Protect and Perform Continuing Education Seminar is brought to you by Flair LLC, maker of the Flair Equine Nasal Strip. Prevent, Protect, Perform. In this presentation, we're going to explore an overall understanding of the Flair nasal strip and its use and application, no matter the discipline. Scientific research supports that Flair strips reduce resistance to breathing, reduce lung bleeding, reduce fatigue, reduce energy consumption, and also quicken recovery. Flair strips benefit all horses. For healthy horses, strips help keep them normal and happy. For bleeders, strips help them recover and reduce the likelihood of additional bleeding episodes. Anecdotally, horses with other respiratory conditions may also benefit. Horses can only breathe through their nose. 80 to 90% of resistance to getting air into the lungs occurs in the nose during exercise. When a horse breathes in, huge suction-like forces are generated that cause extremely low airway pressure outside the blood vessels of the lungs. Of the numerous benefits Flair strips contribute to equine health is that of reducing EIPH, or bleeding. What causes EIPH? EIPH results from the rupture of pulmonary capillaries and subsequent leakage of blood into the airway. Cost to the U.S. thoroughbred racing industry, for example, is estimated to be $100 million a year in diagnosis and treatment. Cost to owners is unknown, but owners do pay large sums of money for unproven and ineffective treatments, which can result in extended time out of training and competition, may require additional veterinary care if associated with inflammation or infection, and may ultimately result in premature athletic career termination due to cumulative damage. What do the lungs do? Well, the lungs bring in air containing oxygen. They remove and release carbon dioxide. They thermoregulate, and they filter blood. What's important to keep in mind is that the respiratory system does not respond to training. The amount of air moved by an unfit horse is exactly the same as when the horse is fully fit. Here's a diagram of the path for air into the lungs. As we see, air enters through the nostrils, past the nasal valve, down past the larynx, down to the lungs, down into the alveoli. Here's a look at oxygen transfer into the blood and how that occurs. And as we can see here, we have the air being brought into the lungs. Air contains oxygen, which is then transferred into the blood across a membrane 1/100th the thickness of a human hair. Increased oxygen is needed for exercise. Increased red blood cells must be available to carry oxygen. Increased flow of red blood cells carrying oxygen to the body, and increased oxygen intake. Blood volume increases during exercise. Splenic contraction occurs, providing increased numbers of red blood cells into the bloodstream. Blood thickness increases due to increased number of red blood cells. Blood pressure increases. Heart rate increases to greater than 220 beats per minute. Volume of blood increases. Blood flow through the lungs increases to 75 plus gallons per minute. Of course, pulmonary capillary blood pressure increases dramatically as well. Oxygen uptake increases. During exercise, the lungs need to pull in 20 gallons of oxygen per minute. What that equates to is essentially 2 5-gallon buckets of air moving in and out of the lungs every second. More dramatically, that essentially is 10 60-gallon bathtubs full of air, which are moved in and out of the lungs every minute. Horses breathe differently at rest and during exercise. At rest, we have the contraction of the diaphragm and the expansion of the ribs. During exercise, however, we still have the contraction of the diaphragm, but the rib cage does not expand. It seizes up, if you will, and the diaphragm acts as a piston frontwards and back. One stride equals one breath. Horses must take a breath with each stride. And here's a diagram which shows the correlation between breathing and stride. As we can see in the 11 separate steps of the stride, we can see the air being brought in through the first 3, 4, 5 strides, and then we can see that the air is then expelled through slides or steps 7 through 9 or 10 here. Once again, and we can't stress this enough, horses can only breathe through their nose. Again, 80 to 90% of resistance to getting air into the lungs occurs in the nose during exercise. We also need to keep in mind that when a horse breathes in, huge suction-like forces are generated that cause extremely low airway pressure. And so what you have is you have luminal or internal pressure on the inner wall of that membrane, and we have negative pressure on the external or alveolar side of that membrane. And so guess what happens? We have the rupture of those capillaries as depicted here. Flair equine nasal strips are clinically scientifically proven to reduce bleeding. Flair strips reduce EIPH or bleeding by lowering the resistance to breathing and the work of breathing by maintaining the size of the nasal passage. Flair strips reduce the negative pressure on the membranes of the small blood vessels within the lung that reduce the likelihood of tearing of the membranes. And so ultimately, clinical studies show that Flair strips A, lower EIPH 30% during low intensity exercise and lowers EIPH 55% during maximal exercise. This is equivalent to Lasix in reducing bleeding at maximal exercise. The Flair strips target the narrowest part of the upper airway. The nasal passage is the point of greatest resistance in the upper airway, and the nasal valve is the narrowest part of the nasal passage. How do Flair strips work? Well, very simply, Flair strips support the soft tissue over the nasal valve. As seen here, Flair strips support the soft tissue of the horse's nose that covers the void in the bony skeleton. As we see here, the young lady can run the fingers down the bridge of the nose, and you can see that indentation where that portion of the skull stops and that soft tissue collapses. Here's a really great picture. This happens in just a blink of an eye. As you see here, the larger picture on the left is the three, these are quarter horses coming to the wire here. And you see that horse, that number 7, if you look just below that red shadow roll, you can see that, that dimpling, if you will, of those soft tissues in the lower right hand where the arrow is. You can see as the horse is in the inspiratory phase of breathing as he is here, you can see how that soft tissue collapses and restricts that airway. Here's a look down inside of that airway, and you can see on the left here, those nasal passages collapse when they're not supported by the external nasal strip there. And on the right, you can see with the spring-like action that supports those unsupported soft tissues on the right there, you can see how much more open that airway is, lowering the pressure and increasing breathing efficiency. Rather dramatic photographs here. What we want to sort of bring into focus here is a law known as Poiseuille's law, and essentially that tells us that very small changes in the radius of the airway cause large changes in resistance to airflow. And so very simply put, if you have a very thick shake and you have the opportunity, kind of think about this on your own. If you had the option of either drinking that very thick shake with a very big straw versus a very tiny, small radius cocktail straw, kind of imagine, would it take more effort and energy and more pressure to draw that in through the smaller straw versus the larger? I think so. So again, there are only two clinically proven options to reduce EIPH. One is Lasix, the other is the Flair equine nasal strip. So Lasix and Flair both work to reduce EIPH by equalizing the pressure across that membrane. Lasix is a diuretic, but it also reduces blood pressure. So the administration of Lasix works to reduce the blood pressure on the luminal or the interior side of that membrane, while the strips work to reduce that negative pressure on the external or alveolar side of the membrane. Now again, we talk about scientific proven methods to reduce EIPH. This is the first of a number of abstracts that we're going to take a look at here just briefly to show where in this, for example, the Journal of Equine Veterinary Science, strips were proven in this particular study to reduce EIPH. And as you can see, the nasal dilator, which refers to the Flair nasal strip, reduced EIPH 22 to 79%. Here's another study scientifically proving strips to reduce EIPH. In this particular study, published in the American Physiological Society's Journal of Applied Physiology out of Kansas State, horses wearing Flair strips showed a significant reduction of EIPH. Here's a study published in the Equine Veterinary Journal, again, that horses wearing Flair strips showed a significant reduction of EIPH based on analysis of BAL fluid. Interestingly enough, there was an alternative conclusion to that previous study, which showed essentially that the strips do not affect pulmonary gas exchange. There, of course, was an alternate conclusion rebuttal, which essentially states that the methodologies used did not permit quantification of the variables stated in the title. Essentially, what we had found out is the strips were essentially improperly applied. And so when the strips are improperly applied and are supporting essentially the skull as opposed to the unsupported soft tissues, they really don't have an opportunity to perform as intended. Here's a study on airway resistance reduction, which was published in the American Journal of Veterinary Research. We can see here out of Michigan State University, the main effects of the nasal strip were a significant decrease in inspiratory airway resistance. And as you see here in the lower portion of this slide under the discussion, tracheal inspiratory pressure and inspiratory airway resistance were reduced when wearing the nasal strip. Here's a research study abstract published in the Journal of the American Veterinary Medical Association, University of California, Davis, College of Veterinary Medicine, 23 thoroughbred racehorses at Golden Gate Fields, again with Flair equine nasal strips. The important conclusion here, severe bleeding was significantly reduced when wearing the nasal strips. Here's a study, again, out of Kansas State College of Veterinary Medicine, proving that the strips were equally as effective as furosemide or Lasix or Salix, as it's sometimes referred to. Wearing of the nasal strips was equally effective as furosemide during maximal running to fatigue. As you see here, the NS nasal strip was equally as effective during maximal running to fatigue. Again, here's a study on the reduction of fatigue. We see here that almost, again, out of Kansas State University, almost 400 thoroughbred horses at Calder Racecourse down in South Florida. Horses with the strip had a win percentage 3.4% higher than those that did not wear a strip. Horses wearing a nasal strip also had a 15% decrease in the intervals to the next race. 23 days horses were back to the races, those who were treated with a strip, compared to with the race-to-race interval before wearing the strip, 29 days. So that's a pretty dramatic study that was presented to the American Association of Equine Practitioners by Dr. Howard Erickson. And so all of the abstracts collectively were looked at via independent review. This particular review found in DVM 360. And what we have here is we have essentially by Dr. Ed Kane looked at all of the studies, and he concluded the studies show that equine nasal strips do in fact reduce airway resistance and mitigate exercise-induced pulmonary hemorrhage. Now we're going to review an alternative application technique, and as we begin the application process, the first thing we want to do that we want to keep in mind is that we always want to begin about 30 minutes before exercise. And the reason we do that is because at the 20-minute mark after the strip has been applied, the heat from the animal will have warmed up the adhesive component, thus allowing the strip to reach maximum adhesion. In the racing industry, for example, that process begins when the groom first steps into the stall to begin preparing the horse for the upcoming race. So before the bridle and the bandages are applied, that's when we want to begin. Not in the receiving barn, not in the saddling paddock, but right when that groom first climbs under the webbing. So before we get into the various steps here, let's just look at the keys to proper application. We want to begin again 30 minutes before the horse leaves the stall or the paddock to begin exercise. We want to make sure we have a clean and dry nose. We want to brush the hair against the grain, and we're going to talk a little bit more about that as we move further in here. We want to prepare the strip. We want to bend the tabs at the score marks, and we want to position the strip 2 finger widths above the top of the nostril. And again, finally, we want to leave the strip on until after the horse has been bathed and cooled out. And we're going to get into a little more detail as we move forward here. And so the concept, again, we want to keep in mind as we begin is that we're targeting that unsupported soft tissue situated just above the nostrils. Horses, again, as we've said, are nasal breathers, and during the inspiratory phase of the breathing dynamic, those tissues collapse and restrict the airflow, as we've seen. And so for the strip to properly support those tissues, it must be applied to a clean, dry, moisture-free, oil-free surface. And so we begin the process by utilizing a clean, dry towel or a paper towel to prepare the area. Again, we want a clean, dry, moisture-free, oil-free surface, as we can see here in the photograph on the left. Now, as the area has been cleaned and dried, what we want to do is then we want to scrub the hair against the grain, as you can see here on the right-hand side. This step lifts the hair up and creates more surface area for the adhesive to grab onto. And sometimes you'll come across a horse with a thin coat or an instance where the area has been clipped for aesthetic reasons. This step will add an additional measure to help the strip stick as intended. Next, we want to prepare the strip. We want to identify the vertical score marks on the outer edge of the strip nearest the 4 tabs, as you can see here on the left-hand side. The photograph on the right, we want to bend the strip at the score marks as shown here. Horses like to rub the stall, the groom, the pony horse, etc. This step adds an additional measure to help keep those outer tabs from inadvertently catching on something, which could lift the strip away from the nose. The view on the left then illustrates how the strip will look after the outer edges have been manipulated at the score marks. And now, because we're not applying the strip to a flat surface, as seen here in the photograph on the right, we want to pre-form the strip between your thumb and your finger. Now, the strip is manufactured with a protective back liner, which is segmented into thirds. What we want to do is we want to remove the center segment and reposition it as shown in the upper right-hand corner. This creates a handle which will allow us to manipulate the strip effectively without actually contacting the adhesive. Once we've done that, we can now remove the remaining 2 segments, as you can see here in the lower left-hand photograph of the liner. And now we have, as you can see in the lower right-hand corner, a strip that's ready to be applied. Now, before we apply the strip, we need to make sure we're placing it correctly. Placement is really key, because going through all of the steps that we've identified thus far are completely meaningless if the strip is improperly placed too high or too low for that matter. And so the rule of thumb is 2 fingers from the top of the nostril to the bottom of the strip will assure correct placement. Using that handle that we've created with the center segment of the protective back liner allows us to strategically zero in on that 2-finger target area with absolute precision. Now, with the strip in proper position, we want you to secure that center in place and remove the remaining piece of the protective liner. Finally, using your thumb and your index finger, we want to press evenly from the center of the strip all the way out to the outer tabs. Begin at the middle of the strip and work your way to the bottom before reversing the procedure all the way back up to the top. These 2 photographs depict strips that have been applied using this very alternative application technique. You can see here on the left, that's a white strip, and on the right there, the black Flair nasal strip. And as you can see, by pre-bending those outer tabs, look how nice and flat that strip lays on both of these two individuals. Finally, after the race, after the barrel run, after the cross-country event, after the stadium jump, really no matter the discipline, we really recommend that you leave the strip on throughout the entire cooling out process. Once again, lungs thermoregulate. The more efficiently you can get oxygen to the lungs, the more efficiently they can perform during the recovery process. So, walk the horse, water the horse, bathe the horse, leave that strip on for the 45 minutes to 1 hour cooling out process until the horse is returned to the stall. The energy the horse saves in the cooling out process will be held in reserve for use upon return to training. Flair strips are approved virtually everywhere around the globe, from the FEI, the USEF, National Reining Horse Association, USEA, the Equestrian Team, US Polo Association, the National Barrel Horse Association, AQHA, and on and on. Hey, thanks for joining us this time. We really appreciate your interest and hope that this continuing education moment was helpful. We certainly invite you to join us online. We have a number of different platforms in the social media, and we really look forward to seeing you again at the next Flair Equine Summit.